Okay, so just maybe we can get started and just have a bit of an introduction so that you all understand what we are trying to achieve and what we're trying to aim. We are Orbsern Systems or Orbsern Corporate Solutions, but we trade as Orbsern Systems. We do have some partnership with Kisatra, who I think from Kisatra we have Dr. Haviz, and we've done quite a lot of work within Zambia, and we're still trying to push that agenda. We just recently decided to start putting out a couple of these webinar series just to maybe help out others that might be having so many questions, and hopefully through the different platforms that we aim to share this webinar and some to come or many to come, we could then have people reach out to us and possibly get into some work together and implement some of the systems that they may need with their hospitals. We have obviously had some good recommendations for all of you, and we believe that conversations with people like you, especially who are frontliners, who are there in these hospitals, doing what you do for our lives, is very important that we hear from you so that we don't design systems that are just good for us, where we think, okay, this is a very good system, and then we don't really know what it looks like on your end. So it's always good to hear at least from your end. And yeah, so therefore, we just really glad to have you all in. And from here, I think, allow Mioba to take on from here, and then slowly. So what we'll do is Mioba will do some presentation, and obviously this is kind of like the preamble and the introduction. But then after that, Victoria, then myself, and then Dr. Haviz will kind of like jump into the Satra system that we have and that we're implementing across Zambia or deploying across Zambia. And then from there, we could, you guys will obviously have your questions, or you could have questions before we do the presentation of the system or some section of the system. But yeah, some of the things we hope and aim that the system is already covering. So yeah, Gwendo, welcome. And yeah, welcome. Apologies for the slight delay in starting of this webinar event. I hope you can hear us loud and clear.
Yes, loud and clear. Thank you.
All right. Thank you very much for your participation and coming through. And obviously, you haven't missed much. So if when we do, before we put it out there, you will have time to actually also preview it. And if there's anything that you feel like maybe we should not put or anything like that, and hopefully it'll be smooth, and yeah, you can let us know. But yeah, you can proceed.
Afternoon, everyone. Thank you so much for joining us once more. We were supposed to have about 6 participants. We currently have 4, and I think due to time, we can proceed with this number.
Yeah, it's fair enough for us to proceed. So yeah, what do you have for us today, Mio, that so that we can, deep dive in this conversation?
Sorry about that. I had some technical challenges. Okay, so I would like to welcome everyone once more to this webinar. Today is the first episode. Mioba Maimbo is my name, and I am your host for the day. I work with Orbsern Corporate Solutions, like Daliso earlier explained, and we are the country partners of Kesatria Medical System. And so our theme is transforming healthcare through digital solutions. And today's topic is focusing on moving beyond paper-based processes in healthcare. Before we do that, it would be best if we get to introduce ourselves. So I will allow our participants to get to introduce themselves. We move on to Dr. Hafiz, then end with my team. So kindly introduce yourself as well as the role that you play in your various respected health care industries.
No, okay, good afternoon. My name is Alwendo Walia. I'm a registered nurse based in Nakonde. Thank you.
Good afternoon. My name is Emmanuel Chenzanilungu. I'm a clinical nurse based in Shingola.
Good afternoon, everyone.
Sorry for
Tandiwe, you can
that.
go on. Oh, it's fine. Dr. Tom, you can proceed.
Okay, so name is Dr. Simon Zatom, currently based in Lusaka.
Good afternoon, everyone. I am Tandiwe Banda, RN and BSc nurse. I work at a facility. So here I work both in the clinical area and also teaching nursing students.
Dr. Hafiz?
Hi everyone, my name is Dr. Hafiz. I'm the implementation head and sales from Ksatria. Yeah, good to know you everyone. Thank you.
We'll move on to the Orbsern team.
Hi
Okay,
everyone, good
thank
afternoon. My name is Victoria and I'm the acting general manager at Orbsern. It's a pleasure to be part of this webinar and thank you very much to everyone that has logged in.
Okay, and my name is Dalitso, and I'm the CEO of Orbsern. And like Victoria said, thank you for your attendance. And yeah, you're
All right. Thank you so much for the wonderful introductions. At least we are well acquainted with that. Like I said, today's topic is moving beyond paper-based processes in healthcare. So, for many years, healthcare facilities in Zambia have relied on paper-based systems to support healthcare delivery as well as manage patients' information. So these paperwork systems help with a lot of things like patient profiling, pharmacy, and the like. We also know that it comes with a lot of pressure. I know wherever we are, we can attest that we've had some mishaps when it comes to these paper-based processes that have been in the healthcare system. And so some of these challenges can be that of files getting lost, um, wrong information being put, and so on. We also know that
think we can't hear you now, Nioba. Did she just? Oh, I think she got kicked out, but that's fair enough. Okay, so while she's trying to get back into Can everybody hear me?
Yes, we can hear
Yes,
you.
yes. I can.
Okay. I think while she's trying to get back, I think it's probably some networking issues. Can you see my screen? At least can you see what's on the screen now?
Yes.
I can.
Okay. So I think essentially what she was explaining is just some of the issues that we've had around the paper-based systems that we have in the country, and obviously with our theme for digital transformation in healthcare, we've got regulatory, like at the moment, our regulatory landscape is, data. We've got things like the Data Protection Act, which I'm sure every one of us is familiar with. And I think in most of that, it just explains around explicit authorization for data processing and requirements for storing sensitive health records with at least national borders and all that stuff, and then making sure that if we're running, let's say, an electronic health record system, we have all these access control stuff in place, all right? But with that, we've seen that, a lot of us, I think also it also depends, it depends on where you're working at the moment. But I know for a fact, because obviously living and growing up in Zambia, I know that most of our hospitals can't and haven't really been able to put these effective systems that, conform with what our Data Protection Act maybe might be around protecting information. Because yes, data is not just, a lot of people would attribute data to just like computers or databases and all that stuff. But even that information that you put handwritten into these shelves and all of that stuff is data. And that information being in the wrong place is just altogether what we're trying not to, I think get done for most of us in our professions. So this has also been like, we can step it a bit further and say, look, the manual building inefficiencies that come with all of these, uh, uh, paperwork-based processes. It's just, I think studies and research are just showing that we've spent more money doing that. So essentially, you would look at a system and think paying for some of these user rights of stuff is expensive. But then when you look at how much you spend on the manual process of actually recording these things, storing them, archiving them so that we're meeting up with what the regulatory requirements are, is costly. You understand? And it's just like, if you look at that, it's close to 18 billion to about 22 billion across most of these countries in Africa, and that are, dependent on such kind of processes. And then also attached to that is just the risk of permanent loss. So imagine how much information will be lost. I think for most of our doctors, it's like, you've gathered all of this valuable information that you put in these books or files or these paperwork that, is kept in these shelves, and you take leave. And then out of that leave, another doctor comes through, and then this is life threatening for someone, and then they can't, access some information that was recorded, and then the whole process starts again. That just delays things for, for the client. So there's just that risk of paper loss. And then I think with our compliance, it's just like, I know in Zambia right now we have, is it HPAZ? Can anyone just direct? Is it HPAZ? Is it?
HPCZ.
HPCZ, yeah. So I know that they have a whole lot of mandatory stuff that we need to put in place, especially around just patient information. And I know that with these processes, I think if they really did like a proper audit in most of these hospitals, they would find that some of these paperworks are not even in the right places. You know what I mean? And the people that have access to it shouldn't even be having access to that information, which will have so many of these practices, uh, just not meeting their compliance requirements. And so, yeah, it's just the digital transition is really, it's really required, I think, from our perspective. So I think I'll try to see if Victoria can take this on as well.
Okay, so let me just share my screen. And
Yeah. Has Mioba been able to log in?
I'm not quite
Yes.
sure yet. Mio, you're here? Hello?
Yes,
I
I
hope
am
I'm
here.
still okay. Okay, so we're going to be looking at the operational impact and the real world challenges of paper-based system. I'm sure many of us have had um, experienced this um, one way or another. And some of the challenges with the paper-based system is that it's time consuming. You consume so much time when taking in patient uh, documentation, and difficult record retrieval. It's just difficult. Sometimes you have a patient that comes through and maybe they've forgotten their file number, and then you have to now start checking through the folders. It can be quite cumbersome and really hectic. As a result, you find queues are piling up, angry patients, very, very chaotic. And another challenge of the paper based system is that there is limited storage space, especially for very, very large healthcare facilities. You tend to find that just to locate a file or where to put it is a challenge. So it tends to add on to the costs, bottlenecks of the healthcare or service provider. And this is something that we have a solution for. And I'm sure as we proceed into the presentation, you'll be able to see how these challenges can be alleviated. And you find that another challenge that we have is increased health worker workload. I can imagine the clerical, the admin clerk has so many papers to fill in. Like when you go to these large hospitals, I'm sure most of you are quite familiar with these things because it is something that you experience on a day-to-day basis. You have so many files that you have to organize in order, sometimes on first come, first serve basis. And it just can be so cumbersome and hectic to do. And as a result, these cause delays in patient care. So the retrieval delays of paper on average is about 15 to 20 minutes per patient records, according to the health information systems. And as a result, it brings about aspects of inaccurate billing of about 12% revenue is lost due to uncaptured services due to paper-based billings. And this can be quite uh, difficult in fulfilling the Data Protection Act compliance in terms of access requests of physical files of the patients. I hope I haven't waffled so much. Okay, so some of the challenges is delays and risks in safety, delays and safety risks. Slow data access postpones critical diagnosis and life-saving interventions, and the impact on administration burden detracts from patient care, and it also reduces job satisfaction. And maybe I'll ask this, like in our current experience, like I'll ask Dr. Is it Simwanza, what are some of the things that you have experienced in relation to paperwork-based systems? What are some of the challenges that you have experienced during your profession? Before I proceed, I hope you don't mind me asking.
Hello. I'd like to jump
Hello.
in before Dr. Hi. Before Dr. Simonza jumps in. So this is addressing everyone here. Don't be limited when it comes to sharing your views. So these views may not be some of your personal experiences. They might be some things that you witnessed happen in facilities as well as the healthcare in general, the healthcare industry in general. So feel free to participate and share your views. Doc, you can go ahead.
Okay, thank you. And before I even go to others, like okay, what I've witnessed, I think let me share my own experience of what I've gone through with the paper-based system. I think on two occasions, my file has actually been lost. I go the first time, so I think months down the line, I don't visit the hospital. I go back to the same place, and I'm told, no, we can't find the file, so we have to open a new file. So again, after that encounter, same thing happened the other time. So this following up becomes a difficult situation now because now it was kind of hard for me, like okay, for them to actually follow up now it's hard. You have to start tracking back now. Everything that was recorded has actually been lost. And as a result, some patients, I've encountered some patients who actually go home with their files saying, okay, this hospital, you're always losing files. People are always complaining. So me, I'll always carry my file. And this is a patient who's having a chronic illness. And when you look at the file she's having, it's quite a huge file. And she actually goes with it all the time home. But the problem again comes in because some other patients that I've seen who go with files home, they don't take good care of the files. So you find that some pages become deleted, and then information now, since it's pain, begins to be erased. So when you're trying to go back to reach the file, it becomes a challenge again. So start filling in the blanks, and they might fill in the wrong blanks if the person who actually saw that patient first is not around. So that's the other thing. And it's actually true. Retrieval time is hectic because when you go to certain registries, you go to the click. Some filing systems they fail. Even though others have got good filing systems, but I've experienced the systems fail. They'll keep these files, let's say these files that have been there for, let's say for a month, patients who have been there for a month, have gone to hospital for a month. But after a month, they'll take them somewhere else. So now, if a patient goes back for review, it becomes a challenge. So now the retrieval time even gets longer. Now you find somebody's actually going to be waiting for a file for 40 minutes and the like. So yeah. And the other thing is you find from the clerk, they go to, let's say, the outpatient department, and from there they're referred to another ward. So from there, once they are seen, the patient does not take back the file. So you find that the clerk has to, or somebody, maybe a nurse or somebody else has to take the file back to the registry. But along the way, you find that the file is lost, and that's how other patients lose files. So that's what I've experienced.
Hey, okay. I think I can second to that. I think while I was in Kitwe, some university, I lost quite a number of files. So I'm with you on that one. In fact, I just ended up just creating new files every time I went because I thought about the whole process when I think that it was not really the university hospital, but it was just one of those local nearby hospitals. So every time I went there, there was a huge line, and I thought if I tell them this is my file number, it's going to take really long. So I'd rather just create every. So they'll always ask, "Are you new here?" Yes, and they'll create a new file, and it was easy for me because then at least I'll get the attendance right there and then. You know what I mean? So I agree with that.
Yeah,
The lost file, yeah. I think for every city I lived in Zambia, I think Livingston, I lost, I don't know how many files. Lusaka, I've lost a couple of files there as well. I think in Lusaka, I've lost plenty of files. Yeah, the file system didn't work. It was very. I'll be lucky to see a nurse that said, "No, I actually know you," or by the reception that someone say, "I actually know you, so let me look for your file." And yeah, so I definitely second to your challenges around that. Any other person with the similar experiences, maybe?
Yeah, I think we can
Uh,
share. I think I can share one experience about 2 months ago.
yeah.
I was visiting my sister in Western Province, and my nephew had chicken pox. So I found him on treatment, and then he had finished his course and everything, and he was supposed to. But then what happened was the chicken pox started reoccurring. So they were like, "No, you take him to the hospital." So I take him there, and we can't find his file. So like, okay, no, just check for his file. His number follows his sister's. So we had his sister's card, and then the person there at the registry just kept checking. We couldn't find it. So she gave us this temporal file. So
Okay.
we moved to the doctor's office, and then she's now asking me, okay, what medications did you give him? And I left everything at home. So now I'm wondering, like, I can't remember. I just know he was on some antibiotics, and then there was this liquid stuff we're applying on his sores. So she was like, okay, do you have his file? So she couldn't give us further treatment. So she just said, okay, let's just observe him for now because he's already been put on antibiotics. So since I don't know what he was given, I can't prescribe medicine to him. And
Mm.
that's how we went back. So imagine if it was something that was not on paper, it would have been easily traced, and
Yes.
the doctor would have probably known what was given and maybe prescribed another drug which could have worked. But yeah, that's how that day ended. We just went to the hospital for nothing.
I see.
Okay.
Yeah, and for you, Chenjeleni, is it? Sorry if I'm pronouncing your name wrongly. What are some of the processes? I know I'm not sure whether you deal directly with processing paperwork and stuff like patient paperwork, but do you have any pain points around that, and how does it look like maybe from your day-to-day kind of operational side of things?
Okay, so just to add on, I feel like my side, like from where I'm working from, like we at times in hospitals we've got people with chronic diseases. So like I'm working from a pediatric ward, and so you
Mm.
find these patients with maybe sickle cell or maybe on ART and stuff. So maybe the time that you are commencing the ART, maybe you did some tests that were kept on record, and so this patient
Yeah.
has come for maybe checkup or something, then you lost that record for you, like the way you checked the last time. So it means those tests that you did have gone in vain, meaning you need to redo the lab
Oh,
test
I see. Yeah.
patient. So there's no
That's
continuity.
quite. Yeah,
Yeah.
that's quite frustrating. Yeah. Okay. Yeah. Okay. I think we can
Yeah.
go on so that we save some time for Dr. Aviz as well.
Yeah, so in summary, well, where is this thing going?
Can I add something?
So in summary, the operational insights around
Uh,
paper-based
sorry,
systems is that
sorry, Victoria, did you want to say something, Miola?
It was
I heard someone
actually,
saying they wanted.
it was me. This is
Oh,
Tandile
okay.
here.
All
Yeah,
right,
I
sure,
just
okay.
Tandy,
wanted
go
to
ahead.
add on what Changelani said, because I also had
Mm.
an experience in the same vein, where you have a file, then they give you that file number. Quite right, you go with the file number, but you lose that card. So you
Oh, I think.
Hi, Tandy.
Uh,
Okay. I think we lost her.
yeah. Tandy, can you get us? Tandy, can you get us? Okay, I think
Okay.
we'll reserve that time for her when she returns so that we can just capture that view as well. So yeah, go ahead, Victoria.
I'd
Yeah,
like to make a
so
comment as well.
Sure,
sure,
go
please go
ahead. Yeah.
ahead.
Okay, so one thing that's common here with all these files getting lost and the time constraints on both the patients as well as the healthcare providers end is this patient's health is being compromised and it's being on hold. The health is slowly deteriorating as these all shenanigans are going on, and it's something that needs to be taken with much seriousness. And so systems are important, but what's more important is systems that prioritize the health as well as the safety of patients. Ms.
Hello?
Victoria, can you go ahead? Hello, Tandy. Hello? Hey, Tandy.
Hello, Tandy. Okay, I think something just came up. Anyway, you can proceed, Victoria. Thank you for that contribution as well, Mioba. I totally agree with you.
Yeah, so in a nutshell, we can see that manual retrieval is a primary care bottleneck, and we have aspects of physical storage costs, which are unsustainable, and digital tools empower workforce efficiency. So I'm going to hand over to Dalisa, who's going to take us through the technological advancements and security. Dalisa, over to you.
Okay, thank you very much, Victoria. Let me just figure out where the share button is.
Let me stop sharing.
Yeah, okay. Um, sorry, I think I shared something wrong. I think someone is trying to attend.
I've admitted her already.
Oh, you've admitted her. Okay, all right.
Yeah.
Sorry.
Sorry, I was kicked out the network.
Oh, okay. Yeah, we were struggling, but yeah, you had something to share. Please go ahead.
Oh yeah, so I was just adding on what Chandelani had spoken earlier because I had a similar incident where I had this file, I was given the file number, went with it home. Then the next time I was visiting the hospital, I couldn't find the file number. Went there, it was difficult for me to trace my file. And we had done some previous tests of which I had to start redoing the same test all over again, which is cumbersome.
Oh yeah, that I think yes, it ties down to what you was actually saying. You know, they just it's we have to redo it, and it just eventually just impacts service delivery. So yeah, definitely. Can you see my screen?
Yes.
Yeah, and it's
Please,
also costly at the same time
sorry.
because I'm saying, and it's also costly at the same time because you need to pay for some certain tests that you do.
Yeah, sure. No, that's true, and I think that's where we're trying to drive at with these sessions, is to help practices such as yourself and probably other different hospitals out there to say, look, this process. Yes, I know sometimes I think different entities are just a bit rigid to change. And when something new is being presented, it just becomes a bit of, can we really try this out? Without actually realizing that this whole paper thing it's a part of us quite all right. And it's hard to kind of let go. So we need some change management here and there. But it's costly. Eventually, it will cost you the same amount of money that you more than if we can put it in that context, then you would put in place systems that are designed to even prevent the loss of some of this information. So yeah. Moving on. Can anyone see the slide, the current one, the technological advancements and security?
Yes.
Or are
Yes.
you seeing my desk?
Yeah.
Are you seeing my desktop or are you
And
seeing my? Okay. All
The
right.
slide.
So, oh, you're seeing the slide. All right. That's good. So anyway, while we've realized all of these processes that we're going through with the paper and all of that stuff, we do actually acknowledge the fact that the world is changing, and with this change, there's good technology out there that is being rolled out, and I think it's also a time where we start harnessing some of these technologies and also maybe doing a bit of an independent research just to see what benefit we could actually get out of these systems and how efficient it would help us. So with that, I just wanted to have a bit of a quick discussions around some of the advancements that have happened. Most of these have already been in place. Maybe we just haven't really gotten time as a country, as well as all these other developing countries that have not really had time to understand these technologies. Or maybe it could be that they've been a bit more costly to implement. I'm sure governments have also looked forward into trying to get things like this in place. I do know that with our country, Zambia, there's been a few, technological adoptions, which is pretty good, and I'm loving that they're really switched on with what's happening around the world and what's happening around the healthcare industry. So with that adoption, we're hoping that with all the different systems that we put, or that we're also trying to put out there, it's kind of like an inclusiveness, and also as well as other providers out there or other companies, that we encourage as many partnerships as we can, especially with the implementation side, and also just to encourage each other as entrepreneurs and trying to put these technological advancements into the country. Yeah, so I'll just discuss, just some of the protocols. Has any one of us ever heard of HL7 and is it for her or FHIR standards? Does anyone know what that is? I think, yeah, Dr. Haviz should know it, but just for all of us in the industry now, or at least for this conversation, anyone familiar with these standards? Have you heard them somewhere and not too sure what it is? Okay, I'll take the silence as probably a no.
First,
Sorry?
no, it's the first.
It's a first. Okay. These are standards that you probably are already using but unaware of. Because I think with things like, I did hear things like lab tests and those test results being stored I'm not sure whether they're being stored in some systems. I'm hoping they are. Obviously, with the challenges that I think Chenjelani brought up, it could be that they're not. But for modalities such as maybe, when you do tests in a lab, that file type will be saved in a certain standard. Probably, I think at HL7, HL7 itself is the protocol, which is basically ensuring that, it could be interchanged across systems. So we could port that information to another system, and anyone can write that system in any kind of programming language, I think, from my understanding. And please, Dr. Aviz, correct me if I'm wrong, because obviously it's just, from the surface. But anyone could write these, program, like develop your software stack or develop your applications for the hospital. But there is kind of like an industry agreement to put that in one system, which is, I think, probably the HL7. And this allows for easy portability into other systems. So meaning if, let's say, government wanted to come into or port some of the files from our system or talk to our system through APIs, there is already a familiar standard. There's already a familiar standard as the HL7 and a few other standards that we won't really deep dive in this because it's not really a technical discussion. But yeah, so it's kind of like that adopted standard out there, and it just ensures that information that is being stored in our system is also properly kept there. So it's not just, Victoria, full name, Victoria Chibolela in the system, and then all of our information is just in some text file that somebody can download and, read straight away. These standards are kind of like aimed to ensure that when we save that file and someone doesn't have access, on the back end, what that looks like is total encryption, right? Serious encryption technology in the background that makes sure that only those that are authorized, and if the system is designed in a certain way, the encryption key that is passed on to that record before it could actually review what it is the right person and is the authorized person. So these are very good standards, and I think over the years have been adopted and adopted across a lot of platforms in the world. So Dr. Aviz will touch on that as well with what we're trying to present in terms of the Kisatra system, because I think that those are, and that's what actually we have in place. These are the systems that are running in the back end in terms of having all these modalities talk to each other and all these systems talk to each other. So Dr. Aviz, I hope I explained that correctly, and please feel free to correct me if I'm not too clear on some of these standards. Regarding the cloud infrastructure, that is also very important because, like you said, some of these files are easily lost because maybe the person that was recording your information in that book was having lunch and they forgot to, maybe the lunch was too great at that time. They forgot to put that file in the right space and somebody else came and looked at that book. It looked like some other book that is used in another department and then it's lost basically. Or for those that are already archived, there's the chance that a fire, which we wouldn't obviously want for most of our hospitals, but in the event that these fires come through and then that archive, then we've lost valuable information across all different patient data. So that's why when we discuss cloud infrastructure, we're looking at the heavy backing that if we say we've backed up this information, it's top tier, storage, and it's replicated across different, and obviously conversations I had with the hospital because some policies around, how this is stored is that some would rather have it on site, on prem. That technology is there to also kind of have a backup copy as well, so that even if that server went down, you could also have just like an encrypted version where only the people in that hospital that have the encryption keys could decrypt. So that's kind of what we're trying to explain around the infrastructure that's backing up these systems. And also around telemedicine integration. So most of this innovation that we're talking about, and also with the improvement of internet-based technologies where we're seeing these 5Gs and the 6Gs and all of that stuff, we have seen the adoption of telemedicine across different countries and across different industries. Different disciplines within the healthcare. So you will be seeing something that we will soon be rolling out around telemedicine because we're trying to reach out to quite a number of practitioners within the country and beyond. So we'll have something obviously, and hopefully you will be available to also maybe join on that webinar once we've had it ready. But yeah, we've seen telemedicine in going out there and helping those far reached places with at least some sort of entry level diagnosis before we could say, look, it's a serious case, go to the hospital. At least somebody then knows that, okay, from here, this doesn't look right, and unlike just waiting and saying, no, I'll be okay, I should just take Panadol. The service can actually be extended. So yeah, just that on the technology. And I'll cruise through quick so that because it's pretty late here on our end, and I think Dr. Aviz is also might have some plans for the Friday today. So yeah, security protocols. I think I've already touched on these. All of this stuff is just encryption technologies and stuff. Once you go through the video, please take time to actually understand how this works. At least that should give you some sort of understanding around these encryption technologies. Does anyone have any question at this point that you'd like me to clarify? Okay, no questions. If you do, just pop them up in your little text box there, and I should be able to go through them quick before we close it off. So yes, I also did forget DICOM, which is a very, very popular protocol around imaging stuff. So I think if you have any radiologist around here or anyone that's worked with radiology and MRI imaging stuff, that's usually what would back it up in the background. And this is also ensuring that, like I said, it communicates with these different modalities. So anything from Philips, anything from any of these other, I think with that one, it's probably they use their own proprietary like technologies. But I know for most of these modalities that are popular in our hospitals, most of them are using DICOM, so Siemens and all of these other ones that were mentioned will probably use their own proprietary stuff. But I do know that they do accept DICOM, and we also have that as an adoption, so we can read these files as well in the system that Dr. Viz will just soon take on. So yeah. Yeah, so I think that's about it. I'll give it on to Dr. Haviz. Dr. Haviz, are you ready to take this on for us now?
Yeah, thank you. Okay, yeah. Good evening. Yeah, it's 9 p.m. yeah in Jakarta. So I think it's in the afternoon yeah in Zambia yeah. So good afternoon everyone. My name is Dr. Hafiz yeah. I'm the implementation head of Ksatria. So what I would like to share yeah is the outlook yeah of moving beyond paper-based process in healthcare yeah. So we are so accustomed to paper-based yeah, even me yeah. When I started my practice we didn't have EHR yeah, EMR EHR yeah, FL, HL7 FHIR those things came popular I think after COVID yeah, when everyone is at their home and we need a standard for the digital health yeah, and there is a digitalization of health and that's where the popularization of EHR yeah, becomes mainstream. So everyone everywhere yeah in any country they're now racing to get their whole health ecosystem to be digital, right? So there is a transformation yeah in the healthcare industry yeah, and specifically I think in developing countries yeah such as in Asia and also in Africa yeah. We see every country they have their own standard yeah, their own national healthcare system, right? They want to develop that yeah to make sure that the healthcare system is upgrading yeah and then also up to the international standard. So I'd like to share some slides here with you. So if you'd like to discuss this topic with me, then that's fine. Yeah, just ask the question anyway. Yeah, just interrupt me. That's fine. Okay, let me open the slides. All right. Can you see my screen?
Yes.
All right. Thank you.
Yes. Yeah.
So we are moving beyond paper-based processes, right? So in a nutshell, yeah, we lost a lot of money yeah, doing manual process yeah, because first of all, paper is using it's not an infinite resource, right? So we need to print paper yeah each year yeah, and then it's getting more expensive yeah. To print that there is a logistical side to that yeah, and then also there is an that error yeah because after COVID, I think the workload of healthcare worker, yeah, I think it's getting bigger and bigger, yeah. And then there are new administration process, yeah. You need to fill in every single year, right? There is a new system, yeah. You need to fill in file ABCD, form ABCD, right? And that's causing error, right? And then also causing the slow retrieval and also other things such as lost records, right? Slow retrieval. That's what being said earlier in this meeting, right? You lost the records, right? And then you have to repeat the process again, right? Like checking the lab, right? And also the examination. That is time loss, yeah. And then also made you possibly you will not go back to that facility anymore, right? Because they have a poor handling yeah, of your records because your records yeah although it is stored by the facility, right? It is your right yeah. That's record is your right, that's your record, right? It is partially owned by you yeah because it's the data on your personal condition, right? So this is one of the key pain points, yeah, lost records, yeah, illegible handwriting, yeah, this is very common. Slow retrieval, no real-time visibility and compliance, yeah, and this is based on research, yeah, that was done in multiple places. And then we can also see before they adopt digital system, yeah, you have to register patient manually, handwritten prescription and notes, yeah, which will take time, yeah, for the pharmacist to transcribe this, yeah, and then also physical file searches, right? You can go to the facility, give your phone number, give your medical record number, your ID, right? And then they have to find the actual medical record, and then you also have fax-based referrals and lab result, right? And they have to print that and then give it to you. There's a risk that the record will be damaged, right? And then also no audit trail, yeah, for record changes. So you don't know who's changing the record, right? What changes made to the records, yeah? You cannot do the audit, yeah, for that. And after the digital, yeah, you can do all of those things, but digitally, yeah. So digital check-in, right? Now the patient goes to a portal and then they can register themselves. And then also the prescription is now digitalized, right? And also linked to your actual stock, yeah. So the stock movement, your inventory, it all can be monitored through the system. You can also retrieve your record instantly, by just putting your phone number, your ID number, even by using barcode scanner, yeah, which in Kesatria we do have barcode scanner, yeah. So you just scan the barcode from the patient ID, and then the system just retrieve that instantly. I think it's less than 1 second. And then also secure referrals and real-time results and full audit logs and version history. Yeah. So this is also available in the system, yeah, when you can see what kind of changes made to the record, who made the changes, the date, the time, what is the reason of the changes, right? And this is very important, yeah, in the modern world, because nowadays patient they are more aware than before, yeah. They know they know their obligations, they know their rights, right? They know that as a facility, health facility, they cannot do certain things. Maybe in the past they can get away with that, yeah. But now patients are more aware. They are more educated, right? So you need this, yeah, full audit logs, version history, yeah, security, right? Because now patients they are more educated than before, yeah. So we cannot do the old things, yeah. Going back to the old times, yeah. So yeah, that's the effect from before and after, yeah. And as a digital transformation, yeah, I think there are several pillars, yeah, several foundations that is the key in the digital transformation. First of all, definitely the electronic health records, right? And then now we can use cloud-based storage, yeah. So it's free from damage, right? You don't need to maintain your server. You don't need an IT guy, yeah, specific IT guy to maintain those server, yeah, in your own facility. There is also data security and compliance with HIPAA compliant encryption, yeah, and also analytics and decision support. So it's not just a system to give patients their services, right? We give them services. We also can analyze, yeah, the trend, yeah. What is my income, yeah, daily income? You want to know that, right? What is the my cash flow for today, right? What is the movement of my stock, yeah, my medicine, how many medicine I'm using, let's say for this month, yeah, month A, month B. What is the top 10 diseases, right? What is the top 10 diseases coming to my facility, right? And all of those things will help you to decide the future of your facility and to make you make a better or informed decision, right? So it's not just digitalizing the health records, yeah, but also doing the analytics, decision support, management stuff, yeah. So not only the patient side is important, but also the back office, yeah, the management side is also included in that. And from the key technologies, yeah, I think if we go to Ksatria, for example, yeah, what Dalitso just mentioned, yeah, one of the EHR systems, yeah, is Ksatria e-hospital, yeah, and we already did several implementations in Zambia. Also, we are using cloud platforms, right? So this is the key technologies. Yeah, we are using Amazon. Yeah, so Amazon is very reliable and scalable, always on. Yeah, and also HIPAA ready. Yeah, so it's a very commonly used server, yeah, or cloud platforms, and then multi-platform access. Yeah, so you don't need a specific computer, PC, tablet. Yeah, you can access the system anywhere, yeah, even in from your phone, yeah. So for example, if a doctor forget to put in the diagnosis, the prescription, but the doctor already went home, right? And then the staff can call the doctor, yeah, or mention the doctor, and the doctor can enter the prescription from his phone, yeah, in his house. So multi-platform access is also key technology. And then also AI, yeah, which is a very interesting thing, yeah, because in 2026, it's now moving to implementation era, yeah, maybe in the 2024, 2023, yeah, it's all about hype, yeah. And when you open ChatGPT, asking ChatGPT to generate images, right? Generate you a story, or anything that you'd like. But now AI can be used to help you do the medical services. Yeah. So in Ksatria, we do have NLP, yeah, or natural language processing, which means, yeah, the AI can decide what is the actual diagnosis of the patient. So, for example, the patient comes with 3 days of fever, high fever, right? And then there is bleeding from the noses, right? And then also red spots, yeah, all for the body. And then you just press the AI, right? And then the AI will think for a few seconds, and then they will fill in the whole of the examination details. Yeah. So AI is very useful. Yeah, it's very good. And the trend of EHR systems, yeah, they will now all incorporate AI because AI is very useful for that. Not only for EHR, but also for other tools, yeah, like the diagnostic tools such as radiology, yeah. I think in the next few years it will all be AI for radiology laboratory. Yeah. So the radiology and laboratory, the AI will come up, yeah, with the actual summary and results. Yeah. And also the doctor, they just confirm that. Yeah. And also review the outcomes of that. And then also cyber security tools, yeah. So encryption, yeah, as Dalitso mentioned earlier, and then also zero trust architecture, yeah, and then also the ability to use multi-factor authentication, yeah. So you can log into the system not only by using your email and password, but also entering the codes, yeah, if you are using Google Authenticator. And then also interoperability, yeah, which Dalitso mentioned. So HL7 FHIR is the latest and the greatest of this standard, right? So this is the international standard, and why this is important because Ksatria, yeah, when we met Ksatria, I think in the 2021, yeah, or 2020, yeah, FHIR is the standard, yeah, because we want the system to be used not only in Africa but also in Asia. Yeah, so we have a lot of clients in Indonesia, yeah, and also some in Southeast Asia, yeah, and the system can be used by them, yeah, and also can be used in Africa. Yeah. So FHIR is the national standard. Yeah, there are also several standards such as DICOM, yeah, which is used for radiology. There is also SNOMED. SNOMED is the standard for the diagnostic tool, yeah, so for lab result and etc. So there are a lot of those standards which is incorporated, yeah, in today's EHR system. So when someone is building EHR system, yeah, nowadays whether it is a small builder or it is or a hospital, maybe they want to build their own system, right? You have to to this, yeah. You have to incorporate FHIR. So your standard should be FHIR because you'll be needing to connect, yeah, to maybe the to DICOM to SNOMED, yeah, and those standards will work with FHIR, yeah. And because, for example, in laboratory, yeah, you have a lot of equipment products, right? They can be from different brands, right? For example, maybe there are Philips, General Electric, yeah, and then many things, yeah, Siemens, yeah, and so on. And that's why we use DICOM, yeah, and then FHIR because we want them to talk and then be able to take the data, yeah, into the system. Yeah. So Ksatria, yeah, we do have this, and we can use API for integration. Yeah. So if you have a lot of medical equipments, yeah, in your facility, oh, I want to send the radiology data directly into the system, right? And that means the system needs to talk with the equipment, yeah, and the bridge is the software that connect them, yeah, the DICOM or the SNOMED. So that's the key technology, in EHR. And when you're using an EHR, definitely there will be an implementation roadmap, right? You cannot change overnight. Yeah. Oh, I want to use EHR. I want to change tomorrow. No. Yeah. You need to prepare certain things, right? So, for example, first you can create several phases, right? In the implementation roadmap. Phase one, you can do assessment. So we'll do kickoff and deployment, right? And then in kickoff deployment, we will discuss what is your need, what kind of facility are you, right? How many patients attending your facility, how many user, yeah, or how many medical staff that you have in your facility. And then after that, we can go to phase two where we'll do the staff training, the data migration, yeah, simulation. So we will migrate the patient data, we will migrate your stock data, we will migrate your tariff, yeah, your service items, right? Yeah, we will migrate the lab examination, your radiology examination, right? So all of those things, we will move it to the system. And then after that, we can do the rollout, yeah, in phase three, where it is go live, which means that the system now is being used for actual service. And during the rollout phase, there will be system stabilization, yeah, because when we do go live, there will be several tinkering, yeah. It's not major, yeah, but there will be some setup, yeah, some tinkering before we find the optimal setup. And then finally, in phase four, there will be optimization, right? So we will give ongoing support, yeah. System needs an ongoing support, yeah. And then also enhancements, right? When you are using the system, you will know that I think there are several things that you want to enhance, right? Maybe the doctor wants to have certain forms, yeah, or maybe the management want to have several reports, yeah, that's not available yet. Then we can do system enhancements. And then finally, you can do also usage audits, right? So you can see the usage audits of the system, yeah. For example, which user is using the system the least, right? So you can do that, and then generate the report, yeah, from the system. So there are four phases, yeah, in the implementation roadmap of a system. You cannot change overnight, yeah, from manual into digital, right? It's a massive change, right? And you need familiarization, right? You need to know the system, yeah. You need to be aware of the workflow, yeah. How to register the patient, how to do the examination, how to process the medicine in pharmacy, and also how to do the billing, right? Those are the four key things, yeah. And yeah, that's why in implementation, yeah, there will be several roadmap, yeah. And the roadmap can be in few weeks, yeah, it can be in a few months, yeah, depending on the size of your facility. If it's a large hospital, yeah, then we will do several months, yeah. It can be up to 3 months, yeah. But if it's a smaller facility like a clinic, then maybe we can do under a month, yeah, in the implementation. And what is the outcome, yeah, of implementing EHR? So when you adopt an EHR, yeah, first of all, you will see a marked improvement, yeah, in care quality. So now the doctors, when the patient comes to the examination room, yeah, the doctors assisted by the system, and moreover with AI, right, with AI development, they don't have to touch the keyboard, yeah. They just talk, right? They just talk, the system will record and then transcribe it into the system, right? That means the doctor can talk to the patient, yeah. Because now, yeah, not only maybe I think in Zambia, yeah, maybe also in Indonesia, right? We have universal healthcare, right? Universal insurance by the government, right? One doctor, they need to examine up to 100 patients a day, right? In a single schedule, like in maybe in 3 hours. Yeah, they need to attend 100 patients. You don't have time, right, to talk to the patients. Now with the ability of EHR, yeah, and also the advancement of EHR, they will have the time to actually talk to the patient and examine the patients well. So definitely the quality of care will be improving, right? And then also reduction in medication error, yeah, which is also one of the key parts, yeah, in a hospital or in a clinic, yeah. I think the biggest cost, yeah, the biggest part that is costing the most, yeah. So it is the one that is costing the hospital and then the most facility, at least in Indonesia, yeah. I think the biggest error, yeah, it's happening in pharmacy. So pharmacy is costing a lot of money, right? So there is an error in medication. Yeah, you will also have unused stock. Yes, some of the medicine that's not being used, right? Because it's not available in the system, so it's just sitting there, right, until it's expired. And once it's expired, you cannot use it anymore, right? So you're losing money. Yeah. So yeah, I think the improvement in medication order, yeah, in prescription, stock, inventory, that's also very useful, yeah, and also very impactful in the adoption of EHR. And also some other things such as record retrieval, yeah. As I said, you just need to mention your name, your phone number, or even using barcode scanner, yeah, and then the system will retrieve your records immediately. And then also admin workload, yeah, it will definitely decreasing, yeah, because we're digitalizing the forms, right? You don't need to sign the paper now. You sign on the paper, yeah, now, but you can use a digital signature, yeah. So you can use a signature pad or even use a tablet, yeah. So use a tablet to do a digital signature, yeah. So yeah, all of these things are measurable outcomes, yeah, and return of investment. So definitely when adopting EHR or a system, yeah, you don't think 1 year, yeah. It will show you have to hit see the bigger picture, yeah. So the benefit, it will show up not in the first year, maybe not, maybe in the second, the third, the fourth, and the fifth. It will show the actual return of investment, yeah. So yeah, that's the digital transformation through HR, yeah. So I want you to know that moving beyond paper based, yeah, is very important nowadays, yeah, because the whole I think everyone, yeah, in every country, yeah, is now doing that.
Sorry, Dr. Aviz, before you
Yeah.
proceed again, I just had a question. I think I've had through the consultations I've had with some of the hospitals, I'm reaching out there. With regards to medication, you did mention expiry and inventory. With the inventory management, is the system in a position to notify when medications are about to expire so that whoever is
Yes,
responsible
definitely.
for that can
Definitely.
actually, take it on? Okay, all right, thanks.
Definitely. Yeah. So I'd like to mention also all of the EHR system, yeah, they will have registration. They definitely will have pharmacy, patient exam, and billing. Yeah, I think 95% of them will have that. But not all of them, yeah, have inventory management, yeah, which is actually, I think, why Ksatria is very powerful. Yeah, they have inventory management, even purchasing. Yeah, from purchasing. So if you have a supplier, yeah, you have your own supplier. You can assign suppliers, and then what kind of stocks that they're supplying to you, and then you can do purchasing, yeah, purchasing order, even return, yeah, returning it to your supplier if there's a damaged items, and then also inventory management, yeah, so you can use multiple batches, right? And multiple batches in a single purchase, they can be with different expiry date, yeah. So that's one of the key feature, yeah. So selecting the correct EHR, yeah, with your actual need, yeah, I think is also key. Yeah, so you don't want, for example, maybe the government in Zambia, oh, you have to adopt EHR as soon as possible. Maybe they give you a deadline. Yeah, maybe at the end of the year. Yeah, you have to adopt an EHR. Yeah, or your facility will be sanctioned. I think you need to do a proper research, not only just picking what you feel is the best, right? You need to do the research, what kind of things that you need, right? And then what kind of provider that suits the best, my needs the best. Yeah. So that's what happening in Indonesia, right? So the government is giving all of the facility deadline, yeah, and then they scramble. Even they made their own system, but when there is an update, they cannot fulfill, yeah, the request from the government. So they have to change. And when you have to change again, that means you have to invest again, yeah, invest your money, invest your time, yeah. So selecting the proper EHR, I think, is also a key, yeah, in your outcome, yeah. Yeah, I think that's what I can give you, yeah, today, yeah. And if you have any question, yeah, or comments, then you can reach out to me, please. Thank you.
Thank you so much, Dr. Hafiz, for the wonderful presentation. Are there any other questions or contributions? Please do feel free to share them. Tandiwe, anything on your end?
Yeah, Dr. Tom, Tendiwe, Changelani, any?
No question from my end. I understood most of the things he said, but if I come up with any questions, I will definitely ask.
Okay, fantastic. Chanjalani.
I think your mic is mute. Is muted, Changelani. Okay. Dr. Tom, any contributions, any experiences with maybe current systems that you're using?
Okay, so no questions, but just a contribution. I think change is inevitable, like we all know. So,
Yeah.
like personally, what I believe is when we're bringing in development, I think the main key thing that we should change is the actual mindset of the users, because pretty sure a number of people have come across Smart Zambia as a system that is being used, okay, in some facilities, and it came with some challenges. People had a negative, connotation towards it. The system is there, but people don't want to use it. And I think one of the challenges that came with it was we're using desktop computers, which was there. And I think that's a mistake they made. People use phones majority of the time, and now they are touch screens. So I feel like when you're bringing in a system, especially nowadays with this digital world, it's easier for somebody to use a touch screen. And like somebody
Yeah.
trying to use a mouse, it slows down the work. That's one of the reasons why some people are shying away from it, because you have a queue outside, then you're struggling to move a mouse. It freezes a bit
Yeah.
compared to when you're using a touch screen. So even as we are trying to implement this, like, okay, first of all, begin to change the people's mindsets. Once that changes, then let's use technologies that people are familiar with. I feel like that's going to be easy.
Yes, yeah. All right. No, I totally agree with you, and it's part of that transformation where we've also we've done our independent research, and we're realizing it's all about the change management. And like you pointed out, sometimes people can be rigid to change, and it has to take really explaining what these benefits are. And I think that's one of the objectives of these series that we're trying to keep rolling out is to kind of like wherever they end up and however they view them, people slowly start looking into saying, look, why don't I actually try this? Maybe this could be it could be a bit of like it would improve my workflow or something like that. You know what I mean, right? And then, slowly that change and slowly it's kind of like a movement and everybody, starts to adopt. And like we said, it's not about just with one maybe particular, it's all about what's good out there, what could help out in different areas of the industry. So I agree with you on that. And we definitely would want to also get to hear a lot about why maybe some digital platforms, especially like you pointed out, them being desktop based. Well, with the Kisatra one, I've obviously I'm privy to some of the demo sessions that we have usually when we're doing client demonstrations, and what we've explained to most of our clients is that we've tried not. We obviously we could put up things like apps and all of that stuff, but we try to make them as accessible as they can. So you just even at a point where you can open it through the browser and it's browser optimized for your phone, and you could just, if there's a queue out there, right? Someone can literally just go with that tablet, check with that person. We can scan their barcode. So if they have a card, the system obviously has the ability to even print out the barcode version of their ID. It can be a little small something, or it could be something that they keep digitally on their phone. So we could literally take a picture of that or scan that barcode or anything like that, and maybe get the ID number of that patient, and immediately we already have information about that patient. And also to add on to how things could even be even made better is that patients can actually do online booking. So they plan, I'm not feeling well tonight, I think I'm going to the hospital tomorrow. They just log onto the website, book, right? And all of that, staff walking, they already have a workflow. They already understand how many people they're servicing for the day. And it's easier to plan out that way. You understand, right? Because then at any given point, people don't actually have to queue up in the hospitals. They'll just know that from 9 to this time, I just easily walk in and that's my slot. You understand? Because that's the availability. Obviously, treating priority cases differently, but there's that option. I don't know if that makes sense.
Yeah, it does make sense. I think it really does make sense. That's good actually.
Yeah. Okay. In the interest of time, I know that it's a Friday, so everybody's it's time to close off, and we have to go out there and plan for some of these sporting events and what games are coming up, and I don't know what everyone else is planning out there, but I think it's safe to say we can close off, and we really, really appreciate for taking that time away and attending this webinar, our very first webinar series. And obviously, we're looking forward to all those questions that you might have. Please ask them because they'll help us, tailor the solution into what is actually on the Zambian scenario. So tailor those questions, put them out. Even though they don't look like they're worth, maybe it might look petty or maybe silly. Ask those questions so that we can also think through, because you are the frontliners, like we mentioned. So yeah, feel free, give us that. And if there's a possibility for you to also give us a shout out, maybe on our platform on Facebook, if you could also just follow those socials for us, we will do this webinar on those platforms. We have a YouTube channel that we'll post it on, and probably those socials as well. Yeah, so please head out there, give us a like, put your comments there, say something about what you've maybe learned today. And yeah, we just build that culture. Recommend other professionals within your network that we can work on with the next part of the series. And yeah, slowly we start to just spread out the word of what we're really trying to do. And also it could also help us partner with maybe already existing like platforms out there, but are maybe doing things in silos. And then we could reach out to them and say, look, we already have this, because sometimes it's not good to reinvent the wheel. So if it's already done, there's just a way that we can all work together, you know what I mean, right? So yeah, thank you for your attendance, and you have a good day. Reach out to us if you have any clients that are complaining about some of these pain points that we've discussed today. Feel free to point them out. I think Mioma has already done some emails through to you. Victoria is also reachable. We also have another manager of ours who's currently on leave. He's also reachable as well. So all of that stuff, please do what you can do. Unless there's any other questions, anything that we missed out, please reach out, and then we can say quick, and then we can close off. Everyone's happy for us to close off?
Yes, it
Okay.
was a really interesting session, and I've learned a lot. And yeah, definitely will reach out when I have some of the questions and more additions to come.
Okay. Yeah. Thank you very much, Dandy. And also, if you want to be a part of the demos, just express that interest so that when we're demoing to any one of our clients, we can get you that link so that you can just obviously check what we're really talking about in terms of our demos. We're happy to do that. Just express that through to me over, and our next demo sessions we could actually put you in. I think I'm getting something from someone. Is it just me?
All right. Okay. Thank you so much. Noted.
All right. Thank you. Bye.
Thank you. Bye.
Thank you.
Thank you. Bye.